Silence only makes violence grow. Silence only fosters aggression and pain. What you will hear in these stories are the silent pain that families experience when the violence and aggression comes not from a stranger or an adult, but from their very children. What would you do if your child of love, the one you dedicated your life to, the one you would do anything for, the one you would shield from any hurt, is the one that's attacking you with words, fists, and any object they can find? What would you do when the greatest source of your love is also the source of your greatest pain? What would you do if no one believes you? If no one would listen? What would you do if you're given only two choices? Send your child away, abandon them, or keep them with you and suffer the wrath of their anger in silence? What would you do if all you have to deal with, everything you have to deal with it alone? Misunderstood, alienated, forsaken by the very community that once supported you. Your family, relationships, friendships in turmoil, and no one blaming anyone other than you. You are a bad parent. You are not doing enough. You are failing. What would you do? The stories you're about to hear are not of families and parents that abandoned their child. They didn't touch their baby, nor did they ever give them anything other than love. In fact, they've given up so much: careers, family, friends, so they can brave the storm the child creates in the hopes that one day they can bring their child out of the darkness of hate and into the light of their hearts. These are not stories of cowardliness, but rather of unrelenting bravery. These are not stories of hurt, but rather of hope. The trust that one day we can all help them together, that we as a collective community can be there for them to weather the storm. We may never understand the horrific pain they've had to experience every single day. I know I don't. Yet by listening to this podcast, perhaps we can hold these families in our hearts and prayers, sharing their reality in our world, to one day become a voice of support and love for those families living with child violence and aggression as they work to love their children no matter how hard the world gets. Thank you for being here. Thank you for showing them why they matter. Thoughts and ideas are everywhere. They permeate our work, our homes, our world. Some help, others confuse. Yet what we really want, what many of us really dream of, is the one real thing we have in common. We all want to speak, to express ourselves in whatever way we choose. This is my safe space for you, just for you, to express your views absent of any judgments or opinions. I just want to be there for you, to hear what you really have to say and embrace your truth, your reality, your experience. Many of the families featured in this podcast belong to the Adopt for Life network of families. Adopt for Life is Ontario's association for kin, customary care, and adoptive parents and caregivers. It's a community of people with lived experience
that strengthens and empowers parents and caregivers to achieve permanency for children so that they can reach their full potential. They believe that all adoptive, kinship, and customary care parents and caregivers have the right to advocacy, support, guidance throughout their lifelong journey. They're not just looking to help kids stay in homes, they're looking to help kids stay in forever homes. What I really love about them is that they believe that all adoptive parents, kin, and customary caregivers have the right to advocacy, support, and guidance. It's a critical thing because there isn't a lot of support out there. And as you'll see with this podcast, for families living with children, violence, and aggression, there's even less support. So while child violence and aggression is an issue that belongs to all families, the adoptive community is more vulnerable to CVA, as many children have faced untold trauma before being placed in a forever home. Awesome. So just following what we discussed last week or a few days ago, actually. So this sort of is just a conversation. You feel comfortable to share what you want to share. If oops, you say something you may think about later. Hey, I don't really want to say that. No problem. It gets edited out anyways, so who cares, right?
Yeah, I don't
So
care.
it's pretty easygoing, and just we talk and get into it and get into what it is that kind of is top of mind for you in terms of child violence and aggression, how it affects the families and homes. So
Okay.
carried away.
Yeah, I'm ready.
Yeah, go
Yeah,
ahead.
take away. What? What's your question? Go ahead. What?
Oh, you want a question? Well, see, because you're
What, you
so
want me to make a speech? What do you want me to
essentially,
talk
yeah. You're awesome at
I didn't. I don't
it.
know.
Well, I think the big question is, how did CVA come into your life? How did child violence and
Uh,
aggression first enter your life and first enter your awareness?
well, it's interesting, because interesting to me. I don't know about you, but so it came into my life because I worked in child welfare,
Mm,
um, and I worked there for 25 years running a center for youth leaving the child welfare system. But I knew about CPVA in a sense through experiences of young people and children, really young children, in mostly group homes, sometimes foster homes, but mostly group homes, where children were, mm, from the staff's point of view, assaulting staff. Uh, Certainly where there were a lot of holdings, that's what they called them then, restraints. And ostensibly the rules were to prevent children from harming themselves, others, or destroying property.
yeah.
And so I was pretty aware of that. Back in the day, there was a policy, a practice, probably a practice, not a policy, in homes where child and youth workers were taught, and it was accepted,
Mm,
that you would escalate a child in those homes on purpose to almost dump out all the anxiety and feelings that the child were feeling. It was there were things called, and still in some homes, therapeutic restraints. This idea that it's actually good for children
okay.
to get all that out. So we're going to do things to trigger them
Right.
so that we could put them in a restraint, and they will square and scream and be abusive and violent and get it all out. And then after that's done, they'll feel better. In a lot of ways, really, what it was about was the staff come into the group home and they want to have a reasonable shift, and so they figure might as well, and it's not. I've heard this analogy, and it sounds awful, but I'm going to say it. They might lance the boil. Might as well get all that nastiness out, do it early in your shift, and then afterwards, things will be better. And then I knew that some of the young people would say, well, we kind of knew what kind of night it was going to be by depending on who was showing up to do the shifts that night in the homes. Because they knew if so and so shows up, there's going to be restraint and there's going to be yelling and screaming and carrying on. And for some young people, that was traumatic, even if they weren't recipients of the restraint or that practice,
Of course.
because they had to deal with it. I remember young people talking to me of being in a home, and the home, some of the group homes are created in my province, but certainly anywhere. They put them out in the middle of nowhere. One, because land is cheaper and housing is cheaper, but two, because it's easier to manage the children. If they run away, there's nowhere for them to run away to, really. And in this case, this home had big fields all around them, and so the young people said, there's 9 of us in the home, and if there was something like that going on, 8 of us would go out into the field just to get out, be away from it all. And even more recently, now that I still hear about what's happening in homes, I hear about because I'm concerned about deaths of children, and there was a death recently of a child um, who died in a fire in their birth home, like their birth family. So it was a family that had a protection order. So there was trouble. The family and the parents were having difficulties with their child. Their child was very young, like 3, and had diagnoses of ADHD, anxiety. How you get that at 3? I don't know, like those diagnoses, but did. Parents having difficulty, single parent. And so the parent locked the child in their room, and then there's a fire. And the parent couldn't get the child out of the room. The child died in a locked room. And so there was a review of this. And people came to the table to review, like, how could this happen and how can we make sure it doesn't happen again. And a lot of the review was about how to get locks on doors that 3-year-olds could open, or locks that wouldn't melt. That was part of the problem for the parent. There was nothing about how to support the parent
No.
to support their child. And the reason the child was locked, and maybe I just didn't tell that part of the story, which is crucial to this conversation. The reason the parent locked the child in the room was because they were having so much difficulty with the child being aggressive and assaultive, and it was really their way of managing the child's behavior
Yeah.
and creating safety in the home.
Yeah.
No discussion about how to support the parent.
No.
No discussion about, well, what was going on with that child? How does a child get anxiety disorder at 3? That label, what do you do about it? What resources were put in place, which there was none for either the child or the parent.
Yeah.
But a lot of talk about maybe we should get locks that don't melt. Can you imagine that? So that's how I entered into it, until and when and during um, I became a parent of children of my own. That, not just a family member of sorts. Some people might when I would work with children, some people might say I was like a crazy uncle, but not a father figure, but kooky uncle. But I got to know them. But then I had children of my own. Uh, and I say my own because it still smacks of ownership of children, which I don't think about, but
Mhm.
children who lived with me um, and saw me as their dad, and I am their dad. Uh, and both of my children have special needs. You know, they're a little bit older now, so kind of glad for them. They if they were if I was identified, they would hate. They would hate me
Mhm.
talking about them, and certainly their special needs, and I acknowledge that. That's their story to tell.
Mhm.
So this is my story. I'm telling you what I think about it, and not even what my wife thinks. So my two children have special needs. My oldest one is on the autism spectrum, has anxiety and ADHD, and those are the diagnoses. The ADHD is like ADHD times 700 in terms of movement and running around.
So it doesn't stop moving.
Doesn't stop talking, doesn't stop moving. Um, and I would say, and this is part of how I understand it, acts in what would be at risk of acting in and not acting out. Because that's what child and youth workers would say in the group homes, you know, the children who are acting out. But there's also acting in.
So
Um,
what is that? What is the distinction there? Sorry, just so.
Acting in is somebody, and the way I think about it is somebody who deals with their troubles
Mhm.
by thinking, brooding, taking it out on themselves,
Mm.
cutting, suicide attempts,
Okay.
uh, despair.
Yeah.
Uh, it's anger. Some of it's anger, but it's
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 within.
directly inside the
Yeah.
acting.
Yeah.
Uh, Still there. Have to learn how to cope with it in different ways.
Mhm.
And then there's acting out and taking all those feelings and acting out. That's my other son, who's youngest, and he has ADHD, anxiety, those two uh, um, diagnoses, and they think it what they call it, which is now called ARND, which is kind of on the spectrum of if you think of fetal alcohol syndrome as a spectrum, then he's on the mild spectrum, mild fetal alcohol.
Okay. And then what is ARND stand for?
I don't actually know what it stands for. It's like what used, from my point of view, it's what used, in autism, we used to call it Asperger's. And
Oh,
that my oldest son, it's like, and then they said mild. I don't know the right terminology anymore. They don't use Asperger's, so they just say on the spectrum. And now they haven't got used to saying on the spectrum of FASD, but
mhm.
it's kind of like that. ARND is the Asperger's of fetal alcohol syndrome.
Got it.
And all this, to be honest, all these diagnoses is there's nothing precise. I long ago learned that it's more for the parents to give parents some framework to understand things to
Mhm.
make sense. Sometimes it helps that way for children and youth to have these labels, and oftentimes it's hard and damaging. But those are the labels my youngest has, and part of the FASD and the ARD is there's that acting out component and the impulse control and all that
Yeah.
stuff. And
You
so
have one acting
that
out, one acting in. You have one
yep,
acting out, one
yep,
acting in.
yep.
And
And
both know. Do they know their
oh,
diagnosis?
oh yeah, of course. I'm sorry,
They're
we
aware of
say
it.
of course, but we're pretty open about that. Like
Okay. Do they feel
they know
stigmatized
there's a
by that,
problem.
or
They
do
know there's a problem.
do they feel
So
stigmatized by that? Do they feel
no. Not that I can see, because in our household, uh it's part of who they are. When my oldest son, for instance, was told, you know, had that diagnosis of autism, he kind of liked it because he said, "Oh,
yeah.
ah, I got an answer. Yeah, I thought I was stupid," or something. now he's a member of a tribe, right?
Mhm.
He's got something.
Yeah.
Uh, and so he felt kind of relieved about it. He's definitely not stigmatized in that sense. He goes to a school. I mean, we're so lucky. That's a whole other story. But he go. I guess it will have to do with um, these disabilities. But he goes to a school with his brother. That's a private school that can give him the support that they can get the support they need. And I would argue there's other quirky because he knows he's also quirky. So there's other kids who are kind of quirky and different, and they all embrace each other's quirkiness, which is a huge protective factor and
Yeah.
huge to them. So any of these behaviors I'm describing, never. They happened in public school and in daycare, never in this school. And
Wow.
and they happen at home still. For not my oldest one is found ways to cope successfully, and I don't worry about him acting in any longer. He knows how to deal with himself, so he's made a breakthrough. I'm so
That's
happy,
awesome.
proud with him. Uh, and it's a part of it is just accepting who he is and what he likes and being quirky and being support. I think being supported to just be yourself. Like that's fine. He was wearing Halloween costumes when he was at he's like 17 now. So when he was 15, he was still wanting to wear costumes. You want to go
Yeah.
do that? You want to? He wore a grade eight. He graduated grade eight. And they had a ceremony, and he was the guy in the pink suit. He made us get him a. He loves pink, so we had to get him a suit. And there was nobody else in the pink suit. But he said, "Do you think they'll think I'm gay?" And I go, "Do you think it matters?" And he goes, "No." And I go, "Well, then I don't know, maybe." I said, "They might tease you." He goes, "I don't care. Whatever." I'm going, "Fine. Whatever you need to do."
That's sweet.
Um, and that helped, and then the school helped, and he's great. My youngest one's 13 now, so he's still having bouts not at school of violence. Yeah, it's not easy to use that term, but I'll tell you why. You got acts of violence at home, but now I would say once every it's spaced out now to once every couple months. Um, I bet we hope that he gets through it. This age of 13 to 14, 15 for my oldest was really hard, where
Mhm.
we were really worrying. And that's where he would go to use this service or that service so much. He's very compliant, so he would go. But we started thinking like how many tests and OTs and everybody to probe and prod him till he thinks like there's something he's he's not happy with who he is. That
Right.
was worry. Um, but seems like about 15, 16, he got past it.
Yes.
And I'm hoping, I don't know, that
Yeah.
sort of walk the same route with my 13-year-old son,
Mhm.
we'll get through it. Like
Yeah.
maybe, I don't know. So, like, I wanted to talk about the violence part, and I used that word, and I realized I'm not that comfortable with that word. But I think it's because my wife would be comfortable with that word. Because in my home, and I have a suspicion, but I have no data, that it's not unusual for the man to be less the target of the violence and abuse than the woman in the home.
Mhm.
I'm guessing.
Yeah.
And I think it's also part because it's not unusual for if there's a good cop, bad cop in a home, for the man to embrace the good cop and the woman to need to embrace the bad cop. And I think that's certainly my way of being, right? I'm pretty easygoing, rules, blah blah blah. And my wife is liking rules and likes structure, and I do know that my kids and do know children like structure, but that's not my forte. Um, and I'm a people pleaser, and I don't like to say no, and I'm conflict avoidant, so I get to be the good guy. Um, and so because of that part, and I'm gonna be so curious to listen to podcasts and see what other parents talk about, because I've never talked to other parents about this. Talk to not other parents who deal with this, right?
Yeah.
I have certainly talked to relatives, my brothers, yeah, but no, I don't know if what I'm saying to you is a common or not common.
It is
I have no
very,
idea.
it's so far from what the interviews so far, what you're saying is very much spot on. And
Oh, okay.
it all depends on, it also depends on, where the child is associating to in terms of the triggers. So, sometimes a child is more triggered with one parent than the other. Sometimes it's both. But definitely what we've found so far is that the more that the child considers that individual to be a primary caregiver, the closer they are with them in terms of primary caregiver, the more that they get triggered when they do have RAD or reactive attachment disorder
Yeah.
and FASD and things like that. So one parent mentioned, I was the trigger, but then as soon as I had to go to work, and then my husband took over for about 6 months, then he started seeing his son behave in ways that he never saw before and towards him.
Mhm.
And all of a sudden, sorry, his daughter, there was the daughter at the time, and it was this crazy sort of like interaction. And it was only because the father started to like really, have to set the rules and be more stern. And
And there's the key, I think, for me, for our house, because even some of what you've said, I agree and I disagree. I don't, when somebody says I was the trigger, no, you're not the trigger.
yeah,
You can't be the trigger. You are a
exactly.
human being. It's not possible. It could be something you did was a trigger, but it's not you. It could be something inside the child that's a trigger, but it's not you. You are not a trigger. You
Mhm.
are a human being.
Yeah.
So if you think of it that way, I don't think it's useful to find a solution. You will have to reframe it to get to a better place.
Yes, I fully agree with
You
you
can't.
on
You
that
can't.
one.
And
So
we
the
teach our
parent,
children, you are not your behavior anyway.
yeah,
Like
and it's not
that's
the parent or the behavior that's the trigger, but the child associates the parent to some kind of trigger. So it's in their head, it's in their mind. I don't know what it is, but it is definitely sometimes, and then from some of the interviews, and you'll hear them, um, the parent would just walk in the room, or the parent would just walk in the house, and the child is doing perfectly fine until that parent walks in the house. The parent has done nothing. They have just existed. And that child now can just think of them. All of a sudden, the child is like, okay, they're not in my mind, and now they're in my mind. As soon as they got in the mind of the child, it started happening. And the parent has done nothing, not even said hi. They could just hear the door open, and then all of a sudden these kind of, and it depends on the severity, but it's
yeah. I'm sure
to
it
your
does.
point, it's not the parent at all. It's not what the parent is doing. It really is something that is a creation within the child's mind. But
Well,
you know,
here's what I would say. Probably true, but I would say this, and this is also not from my parenting experience because I just know my experience. Um, but from other experience is that it's trite, but every child is different. Every person is different. None of this is precise. None of the diagnoses, none of the what's going on in the child's mind, brain, history is precise.
yeah,
So every situation is different.
everyone is
Every
different.
single one. It has to be. It it's just if you accept that no one person is the same, which most people will accept that as an assumption,
Yes,
and it's not possible for every situation to be the same. It's actually impossible.
yeah,
So you can't make generalizations. Every situation is different.
Yeah.
So I don't know what to say about what you said, but I could see some theories, people saying, well, and we've done this in our house, thought through it.
Mhm.
Maybe it's safer, right? Maybe when that parent enters the house, it becomes safe. And the child can do that, can explode because they know they'll be contained. For
Yes,
some children,
exactly.
for a child, that's a possibility, right?
Yeah.
I got all this shit in me. I need to let it out. I'm angry. And you know what? I don't even know why I'm doing this, but when you enter the house, I know I can do it and somebody's going to control me.
Yeah.
That I heard that. That's a child and youth work
Yep. Totally.
mantra. I
Yeah.
don't think it's true for all children, but I don't discard it that that's possible.
Mhm.
Um, but you know, the other thing is there is an element of, and this was it for us, and I would say from the stories I've heard, uh, I told you that thing about the parent locking the child in the bedroom because they're so frightened. And I've heard stories about parents locking themselves in the bedroom.
Yes.
I have thought about at times putting the knives away, but there's been no threat from my 13-year-old about that.
Hopefully.
I have thought about when my oldest son was younger, worrying about where was he in his room at night? Is he going to harm himself? I did
Of
tend
course.
to be kind of dramatic and catastrophizing, but I have thought about that. I would say I haven't seen what other parents have seen, but certainly we've had to do restraints, and uh, in recent months, my youngest son has usually when it's a matter of power and control. Uh, uh, said threatened my wife. Let's get into a fight.
Oh,
Um,
wow.
yeah, and hit my wife.
Oh, wow.
And he's little for his age, but we do know like what's going to happen when he's older, and we can't give him a restraint because he'll be too strong for even right now. It takes both of us. And from my wife's point of view, and this has been ongoing because it's not new. The behavior, like there, when he first went to daycare, um, we got called when he was uh, he was underneath a table at daycare. I can't remember what age he was at. Underneath a table at daycare, and they wanted him out. And one of the daycare workers tried to. He wouldn't come out, so they went and reached under a table and grabbed his arm and pulled him.
Oh,
He
no.
went, yeah. And as soon as they tried that, he went berserk. He was throwing the furniture around the daycare. They did this thing because at that daycare they were not permitted to do restraints, so they remove everybody from the daycare, and everybody has to leave, and he's left there. They didn't call the police, thank goodness, because he was so little. They called us, and um, he didn't destroy the daycare, but he threw a lot of stuff around. And it's really interesting because he did it. And even when he does things like that at home, when he's not, if he isn't being violent towards us, he certainly might be aggressive verbally. And he will go in his room and punch holes in the walls or kick them or break his toys and usually he breaks and throws outside his room the things he really likes. Yeah,
Wow.
it's very interesting, eh?
The things he really likes.
Yep, the things he likes, and he says, "I don't like them anymore." Any poster that he asked for that was on the wall, he'll take it down. Um, yeah, it's really interesting. So we thinking, "Well, what's that about?" And um, what was I going on? So, oh, I know. Usually, the triggers aren't. It's not like me or my wife. My wife interprets it as when he doesn't get his way. And
Mm.
it's like, and that's where I go for power and control. when he wants something, he wants more screen time, he doesn't win because he's when a rule isn't followed. So it's not the rule itself. If you don't do what the rule says, it pisses him off, right? It
Mhm.
I don't even know what it does. It does something inside him. It's a trigger. But
Right.
if you said tonight we're gonna have French fries and you figured out there were no fries in the fridge, so you couldn't, this is not good. If you they,
Oh.
this sets him off. It's um if he if he has to go to the dentist, well, he's just gonna say no, he will not. Like, and we have to go to uh, a rehab hospital. He doesn't to go to the dentist where they put him to sleep, and even then, it's trying to get him there, and he has to be put to sleep. And if he isn't, there was a time when he had to get a tooth missing because he wouldn't brush his teeth either because he hated the taste of the toothpaste. And then we didn't use toothpaste. And he didn't like the feeling of toothpaste. And it was a bad. Everything was a battle, and everything was
Wow.
child management because if we didn't manage the child, there could be an explosion of some sorts. And when we would go to see our pediatrician, I remember a pediatrician would say, because my wife would say, but he needs consequences, right? He needs, like, he has to learn consequences for behavior. He can't just get everything he wants. He can't freak out and have a fit and then, time later come back. He doesn't say he's sorry, but wants, even my wife, after he hits her, he wants her to say, this is my impression of it. You're okay. We're still good, right? And so and she's saying, but I want this to stop. The only way to stop it is through consequence. We had behavior therapists with us that tried to do that. It didn't work.
So
Not,
how do the consequences work? How are they working?
they're terrible.
They're
Because
terrible.
this is my position on it. The
Yep.
pediatrician told my wife, because I'm going, I get it, but I'm Mr. Nice Guy. So you just want him to have everything he wants. You'll say yes to everything. I'm going, no, I want to de escalate everything. I
Yes.
want to make sure it doesn't get to the point where he blows up.
Yes.
And well, what are we gonna do when he's out on his own and he's gonna be in a bar and he's gonna punch somebody out? Because
Mhm.
I'm going, he's 13. Like, but we haven't found a way, and I mean the royal we, of teaching him another approach to dealing with whatever he's dealing with in because he's not a talker, so he's not going to tell us his insight. He might not know what's going on. He's not going to tell us, but how does he deal with this? But we know what he's going to do. We know what's going to happen. And the pediatrician said, like, I can tell you that yes, he has to learn consequences, and yes, there needs to be consequences, no doubt about it. But if you think consequences are going to change his behavior, you're wrong because he's just going to do it over and over again. And you can have consequences, but that isn't going to change anything, right?
Yep. Yeah.
And it's really difficult. I get it. That's really difficult for my wife to comp. She's really smart, so she understands it, but it's not her way of looking at the world, right?
Yeah.
And
And it's important what you're saying because there is on one level, like as your wife mentioned, you do need to have the consequences. You can't just walk away for free, even though we know that the triggers or are not your fault. It's not something, it's something that you're behaving to that's inside of you that you're dealing with. But on the other hand, like you
and
said, and I fully agree, and this is common that we're seeing in CVA. It's the focus should not be on the consequences initially. It should be on the de-escalation, because what we're finding so far, and again, like you said, every child is different, but that de-escalation tends to provide the greatest success, so that the consequence that could be put on later on, or we call it outcome, not even consequence, because that's so negative, but just an outcome of that, would be, would be more sort of, adopted. So the whole point of an outcome is that, hey, you know what, I'm responsible for my actions. Therefore, if I do something, there's an outcome that's going to happen, and then I'm going to be reminded that this action that I did, stepped over a line, stepped over a bound. But how do you get a child who's going through, a traumatic state where they're in fight or flight and they're just trying to deal with things? How do you get them to even conceptualize the concept of a consequence or an outcome? It's just not possible.
Right.
That's the key.
And there's all this talk. So let me just say this. I think I presented pretty simply, and I think my wife and I are both probably right.
Mhm.
And that's the complete, utter, confusing challenge that this is not, there's no simple solution because every child is different. Every, relationship between husband and wife or parents and
Right.
a single parent, and it's different. Everybody has backgrounds. My child has a personal history. Every child has that. They have whatever's going on inside them is all different and it's complicated as crap. So what really is the trigger and stuff? Who knows? And there's nothing I'm saying that, there's no one way. Is it true that I'm Mr. Nice Guy and I contribute to that? Because he might find he can get his way and I taught him how to do that. Yeah, that's true.
Mhm.
Of course. I think that's true. Does that contribute to the problem? I think probably. Is it the whole problem? No, not at all. Right. Um, is it all his ADHD? Is it his anxiety? I don't know. Is it the fetal alcohol syndrome? Maybe some of that too. I don't know.
Mm.
Right. Is it he's adopted? Is it he's adopted? Because some people say, oh, he's got worries, he's feeling grieving about being. Do I think that's true? Not that I think, but could it be? Is that part of the stew? Yeah, probably.
It's very complex.
It
It's very
yes.
complex.
So to say there's a great answer to muddle through, here's what I think. If I'm giving advice to myself or parents, is long game. Your child, my child, has their own life, their own journey, they're themselves,
Mhm.
and I am determined to walk alongside them. This
Yes.
becomes part of my journey. So we're now on a journey together. Where we're going, how this works, I have no effing clue. I don't understand myself any better than I understand my child. I'm working on that too. So it's our journey. This is it. And tomorrow will be another day. I don't know what's going to happen when he's 14. I don't have control over it. Neither does he. We'll see.
Yeah.
So we're on a journey together. That's as best as I can figure out. And
It's
every day new. And so, yeah, that was today. If he has a incident today, and I have to let myself off the hook because I can see when we cause it, right? When the cause it is not fair. I can see when we do something that escalates it. We get emotional. I can see the minute we touch him, right?
Mhm.
That's an ask. I know what's going to happen. So we know we can do it, and it depends. And I'm sure you're hearing this, how tired, how emotionally prepared we are, how hard it is. And because I am not generally the person who is I mean, I get the verbal abuse, yeah, whatever. But he won't come and attack me.
Mhm.
And so I'm usually secondary in terms of, it started and then I'm helping with the restraint.
Yeah.
But my wife, this is not, I know it's really hard on her, hard, emotionally hard to be, um, she doesn't use these words, because she's such a strong woman. But to be I'll say, to be a victim of that, the recipient, a victim of that.
Yeah.
And there's a whole for I think there's a whole framework of women experiencing that from children, especially in my case, boys.
Yeah.
I don't have a worldview. I don't have an experience. I don't have a way of understanding that a woman would have.
Yeah.
And and so that's an important framework to include. But I can't. I don't know what it's like.
Yeah.
And sadly, well, my wife, like most women do, does know what it's like.
Yeah.
Not just from my boys. This is the world, right?
Yeah.
Whether they've experienced it personally, and one third of women have had unwanted sexual contact with a man at minimum.
Hmm.
Um, more uh, have felt abuse from men,
Yeah.
physical or emotional. It's Yeah, they know what that's like, and so this is in that context too.
And it's
Um,
so valuable, the point you bring in. And we both, as men, don't we I can't imagine what it is like for any mother to have to go through this, because there are so many other triggers, from society, from any unwanted sort of like aggressions that they've had to live through. And I can imagine the kind of triggers that the children's are causing within them. And I know one mother was saying at one point, she had to dissociate. Her youngest 3-year-old was hitting her, and of course wasn't harming her, but physically, because they weren't strong enough. But it was harming her inside. Like, she was feeling every single hit inside, as if it was like a big man like beating on her, and she had to dissociate from it. And she would just lie down on a couch, and she would have her 3-year-old beat her while she was sleeping. She'd have
mhm,
to sleep. She literally would fall asleep and wake up, and the 3-year-old's there just all frustrated. And it was like, it was this level of, that's what struck me with what you were saying, is that I realized this is way beyond me. I can't even understand that, right?
mhm,
I can't even understand the reverberation of that child beating on the mom, and the other effects that it has on their past, and what triggers from the past, and everything that the mom has gone through, you know, growing up. Like you said, 2/3 of women have had, unwanted aggression being thrust upon them. So that's huge. And I'm glad you brought that piece. Two things though, two things that you said that really reverberated with me. Number one was that this concept where the we are there with our child, we are there to be with our child, and we don't know where the road's going to lead, right? And I think it's really scary for a lot of parents to say, I don't know what's going to happen. But, and I love the way that you are so abandoning yourself to the future, to what's going to happen, because we don't know. And unfortunately, with children, with families living with CV, at least from what I've seen so far, there really is an unknown, because you don't know where your child's going to end up, and there's a lot
it's
of faith and hope
awful.
that you have to have.
Yeah,
Yeah.
it's
To,
awful,
yeah.
but that's true.
Yeah.
Uh, you think, is this gonna? Yeah, exactly. You don't, but if you accept that, maybe crushing, like if he's homeless or ends up in jail, and so we think about that with our youngest, and try not to catastrophize, try and be positive. Um, and if it ever happened, it would be crushing. Uh, but we don't have complete control over that.
Yeah.
We can't. We're gonna struggle to do our best to support him to learn other ways of behaving, managing. Uh, and it's not about his will, because and I'm thinking about the youngest one. We tried. He's for a, for a while. My wife was convinced, because she's like mindfulness and stuff, and he did the SNAP program twice now with
Oh,
SNAP
great. There you go.
certificates. Like, come on, I thought that was evidence-based practice, and it didn't make any difference. He's done, had seen a behavioral counselor. He's my wife. I was going to tell you my wife mindfulness. So we went to family yoga class,
Okay.
which worked as well as the family karate, the taekwondo class. Like, yeah, I hated it, but I'm not a yoga guy, but I had to suck it up and do it. And my oldest son did it, and my wife who liked it did it. My it was it was awful getting there and then getting my youngest to do it. So he's like, you know, then I remember him sitting in the class with the yoga mat on his head. That's what he did with the yoga mat. He was on strike. It's like, oh my god. And so we feel we tried everything. Maybe we'll find something. We'll keep trying. But I want to ask you and say something about it because I know it's another topic that parents hate to talk about, which is medication.
Yeah.
And so I can only imagine that, like us, that was a big question, right?
Mhm.
Does medication, is it work? And again, my experience in with children in care was that medication was used as what they'd call a chemical restraint.
Yeah.
So we'll dose them up so that we can have a good shift at
Yes.
night, the workers.
Yeah.
Well, frankly, for parents,
Mhm.
we'll dose them up so we can have some goddamn peace at home,
Mhm.
right?
Enough fear for our lives.
So I criticize the system for trained child and youth workers over medicating kids.
Mhm.
So the house can be, but it's not. It is not fear for our lives, but that's not all you're dosing them up for
Yeah.
because it's not fearing for your life, but it's also so you don't have anxiety yourself as a parent, so you don't worry that something could happen in your house, so that you can watch a television program
Yeah.
at night, so you can maybe talk to your mother-in-law or whatever you want to do. So you
Absolutely.
might be able to leave them with a babysitter, might, and
Mhm.
go out for an hour. This is what that's about. It's not just about fearing for your life, right? I'm certain it is part of that. But and what is all of that? What's wrong with all of that? That you parents shouldn't have all those things? Of course they should. They're people too. They have their own journeys, just like I said. So I am a bit resentful of the child welfare system for relying on it.
Mhm.
However, I have to admit that when we were parents, I didn't like to rely on it, but we did talk to the pediatrician. And of course, a medical person is not going to have the same worry about medication that
Yeah.
I, as a non-medicated. They're the pill pushers, right?
Yeah.
Not really, but they're the vaccine pushers, and I say it in a positive way. They want us to get vaccinated. They're
Right.
doctors, they're medicine. They created vaccines. It's
They
logical.
believe they
What's
believe in
wrong
the
with
myth.
it? What's wrong with the medication? It's going to be fine.
Yeah.
Yeah. And so, okay. So both my boys are on medication that works. I would tell you that's been part of the reason why they do well at school. It's not just the only school. Um, we used to have this thing up till recently, even for both of them, because they go to school on the medication, help them manage at school in terms of focus is ADHD medication. But for my youngest son, it has a great deal of effect for him managing his whatever the emotions, the
Mhm.
whatever is inside that causes him to blow up. He can manage himself differently on medication, on his ADHD medication than he can when he's off.
So is it better or worse? Can he manage himself
And
better or can he manage
much
himself
better.
worse? Much better.
Yeah, like yeah, he's a great guy. Well, he's a great guy all the time, but his greatness is shows up even shines more brightly. He's
Hmm.
very shy, not on his medication. He's very shy in public, not at home, but he's very shy.
Mhm.
and so, but he can focus,
Mhm.
and my oldest son can settle, and my both of them know what it's for, know the medication. It's their choice. Um, we used to not give it to them on weekends, and of course, when they come home from school, the medication's worn off. So the parents get
Yeah.
to deal with what I expect is all the pent up emotion inside from trying to being anxious and trying to deal with school and feeling whatever feelings, feeling dumb, feeling
Mm.
trying to fit in, whatever they're doing at school, and yeah, when the medications worn off, you get them, and they crash too. There's a crash that come. Any parent with kids on med will know about the crash. It's all pent up and they crash.
Yeah.
So we have to deal with that. And on weekends, we said, well, we'll give them a break from it until my oldest son, he kind of said, like, when I'm not on my medication, you guys are always yelling at me. And we didn't actually
Oh,
realize it. So he said, I think I should be on my medication so that I don't get yelled at as much. It was an interesting way of acting in. And he was right. And when we went back to our pediatrician and we were talking, she was great. She talked to him about it and then had it. She said, why would you take him off his medication? This is a doctor's point for the week. And we said, well, we thought we could break. He'd go, yeah, but he doesn't have a break. Actually, he really likes it at home. But when he's not on his meds, it's making it so he doesn't like it. So if he wants to take them, why would you not let him take them?
yeah. Yeah.
That's not about him. That's about you,
Uh,
right?
Very
And
smart.
if he's not irritating the whole household because he won't stop talking or he bumps into people and this is his way of using it to manage himself. Why are you? Would you if it was a crutch and he was hobbling along because he only had or a prosthetic leg? You
Mhm.
say sorry on weekends you're not allowed to use it.
Yeah.
Like she said, it's medicine, right?
Yeah.
Going okay, okay. Yeah. So he takes it when he wants to, and
Yeah.
it's almost always. And my youngest son, which tells me something, even though he won't really talk about it like my oldest will, my youngest son will ask, like in the mornings, it's now routine. He will ask for it. He wants it,
Okay.
right? And he knows it changes, it helps him manage his behavior. I don't know how that works inside him.
Yeah.
So am I against medication? No. Has it helped us? Yes. Do I know we are fortunate to have found this one medication for now that works for them? And actually it's the same medication in the same dose. Isn't that weird?
That is so weird.
And I don't know what that's about, but it is. And so if it works for them, bless us, right?
Yeah.
I know for lots of parents, they're on a medication road, right? Not to that they have the right dose that doesn't make them zombies like
Yeah.
dead because
Yeah.
we've seen that where
Yes.
you figure out with the dosage and you say what happened to my sons, like that's not my sons, that
Yeah.
if that's them, I don't want the medication, right?
Yeah.
Because they lost their life, they're not the person anymore, they're not, that's too much, so they're
Yeah.
not like that at all. We're very fortunate. um, mm, that's my position on it. I know some parents will feel it's a struggle to talk about it because if you go just into a regular crowd of people,
Mhm.
there is using medication as a substitute for good parenting.
Yes.
But
Yeah.
and I don't believe it's that.
Yeah. And I'm so glad you brought it up because it is a big issue. And in fact, we haven't really talked about it so far in the podcast, but it is.
Really?
No.
Nobody mentioned nobody's tried medication with their kids? I
And
don't
I'm
believe that's
actually going
possible.
to, well, so here's the thing. Nobody has said that they've dealt with medication. So how much
That
of
I
it is
believe.
a
That's what
taboo? How
I
much of it is a taboo, like you mentioned, is what really struck me.
because I don't believe it's possible. But if it is, I would ask you to ask them why not.
I'm going
It would
to. I
have to be a
literally am.
conscious decision. They
Yeah.
had to decide not to do that.
Yep.
And
Yeah,
why do you say
I would
no?
be surprised that they haven't, now that you mention it, but it's funny because it never came up so far. So, which is interesting because how much of it is really a taboo, right? And how much of that medication, if you find the right medication, if you find the right dosage, if you've got the buy-in from your child who wants it, right, who feels that there's a need for it, and you're providing the opportunity for it in a controlled environment, why not?
I
Why
know
not?
the arguments. So the argument is exactly, and I used the word and then I took it back, right? Because it is it a crutch? And and so here's my pediatrician's point of view is yeah. He said, yeah, there's something going, so this is a doctor's point of view. Not I'm no doctor. And
Mm,
other people can say other things, but he's going, if it's if it's ARND or autism or whatever, there's something going wrong with the brain functioning.
mhm.
And in this case, he'd say, I think your sons, and they were born addicted to crack cocaine. So he'll say, well, the
Wow.
medical evidence is that causes frontal lobe damage.
Yes.
So yes, it's a crutch because they need the crutch because it helps support the frontal lobe, which was damaged. What's wrong with that? He is his position. What's wrong?
Mhm. That's smart.
I don't. He would shake his head. I don't get it. Why would you not want them to
Mhm.
have the medicine?
Yeah.
It's something in. It's a chemical imbalance or damage.
Yeah. There could be a lack of
Bad
development in a
people.
co-development process.
It's
That's
not
the
about you. It's not about them. They're not bad people. But why wouldn't you want that?
yeah, yeah. That's
And
really,
then
really wonderful.
other people would say, well, maybe they're, and I worry about it because all this psychotropic medication, what are the side effects? We don't know. I believe we don't know. The long term side effects because we haven't used them long enough. There's not generations enough
No.
and studies enough to know when people are 80, is there data on did this affect them? I don't know.
Yeah.
I don't know. And so it's a gamble.
And I think the other sort of part you mentioned, which really struck me, was this concept of where people, if you talk about giving them to your child, people think that that's just a substitute for bad parenting.
Lazy, lazy,
Bad parenting, right?
bad
And
parenting.
then a lot of parents with CVA, even their own families, their neighbors, people, parents, families that are living with CVA, they say the number one thing that really hurts them the most is not the fact that they're just alone to deal with this. There's very little support structures to deal with it. Although it is getting better, they said that they get alienated as bad parents. People just think they're not disciplining enough, they're not doing something enough, they're not controlling their child enough. Um, you
Yeah,
know, and that really hurts them the most because they feel completely helpless and alone. And a lot of the messages come from people close to them, like close friends, neighbors, family members. They
yeah.
they really feel like this has been a big issue for them because not only are they having to deal with it, but they also have to deal with the stigma that somehow, they're bad parents when they're not. In fact, they're incredible parents.
Yeah,
Opposite.
I see that. I think it goes the other way too, where it might be bad parents, but there are some people, relatives too, who will might think those are bad kids,
Yeah. Yes.
and so it's not the parents or both of the parents. Maybe it's one or the other that gets the blame, but they also might say that that kid is a bad kid,
Yeah. And they've had that.
and they push those kids away or somehow different, and the kids get that message too, um, for sure. And then there's a whole element, I'm sure you've heard this, like for us to do babysitters are you can't have your relatives be the babysitters. If you're lucky to have relatives that would, in normal circumstance, whatever normal means, be willing to babysit, you can
No.
because you have to protect the babysitter and the child.
Yeah.
And for me, I think of it both ways because I believe my children do not, when they're acting out or in, but when they're acting out, the one I'm talking about, he doesn't want to do that. He doesn't wake up unless he's in a grumpy mood and he's ready for it. He doesn't wake up and say, Today is going to be another day in which I'm going to be violent against my mom." No, he doesn't want to do that.
It's not. No,
And so he's not a bad kid.
no, of course not.
It's not it, and my wife says, but it's intentional. I know he can control it. I don't know. I don't know what's intentional. But she will agree with me. He doesn't want to.
No.
He doesn't, and we don't want it either. So if if people, we can remind ourselves, that the other thing that I would mention that I'm sure other people would, it's not just me and my wife that are affected. It's my oldest kid,
Yeah.
right? And just like in the group home, they're no different, right? In the group home, all the other kids are affected by what's going on. But yeah, so
With the other child, the sibling.
yeah, and it's trauma. It's trauma for everybody. It's trauma for the parents. It's trauma for the kid doing the violence or the aggression.
Yeah.
It's trauma for the other kids who are witnessing it in the house. And yeah, we think about that too and worry about that.
How do you manage that? How do you kind of find a way to isolate the two boys when say the youngest is reacting out? Is there any methods you use?
What we do, if there's a incident, we do ask my oldest to. We don't use the word isolate, but leave, not leave the house. Go to your room, or we have a house, so we can go to another part of the house,
Yeah.
do something. But we're gonna take care while we're taking care of this.
Okay.
Um, Obviously, when things are over, we talk about it, what caused it. My oldest son is comfortable enough to chime in about what his version of what's going on is.
Perfect.
Um, it's not any strong analysis. It's more about he's just being wimpy because he doesn't get his way. My oldest son, at times when it's not going on, my youngest son knows what my oldest son thinks,
Mhm.
so they get along. Um, they're always together, get along. So
Mm.
it doesn't seem to influence my youngest at the moment, but they it's not a secret. It's not. They both know they take. They both know they take the same medication. They both know they're at the school. They both know they have some kinds of disabilities.
Yeah.
They see it all, so it's not a secret. But certainly, my oldest doesn't interact in it. Right? Doesn't help. Doesn't do
Yeah.
anything. We move him, and we talk about. We try with my youngest to, after it's over, to talk about every single time. And I think it's important to try. I don't think it makes any difference.
Mhm.
Say what happened, what's going on. He's so not verbal about that stuff, or insight isn't his thing. Try to once again go over what could have happened differently,
Mhm.
right? Instead of that, that wasn't good. Now you have a consequence because there always is a consequence.
Of course.
And now you don't have your screens for 24 hours. And usually by the end of it, he's accepting of the consequence. He doesn't go up again. And what could we have done differently so you don't get that? But we haven't found a method. Nobody seems to have found a method where
Mhm.
he can consciously do something different. I'm hoping as he goes older, there'll be something. You know what did happen? I'm sure this helped in our house, and it would help. I'm sure you other people might have mentioned it. Is we my we got a pet, not a therapy dog, because my wife hates dogs for a long other story. But so we got a cat, but the cat was not for my youngest son. It was for my oldest son. who is very, very anxious, but anxious inside, not outside. So nervous, doesn't like going to the store. Even at 17, doesn't like going on a subway by himself. It's just nervous. So, and he loves stroking a pet. He's tactile because that's part of the autism spectrum. So, we got for him. And I did know cats, they're not, they don't always want to, you don't get to, they're not dogs. Come here, dog, and no matter what, dog will let you pet the dog.
Yeah.
That's their life. Pet me, please. And so the cat didn't, but we have a reasonable cat that allows you to pick her up sometimes. And we were so surprised. It was not my oldest. He didn't give a shit about the cat. My youngest. So it's a therapy cat for my youngest. And it's the cat allows him to pick her up. She sleeps on his bed. He he can. It's one thing he's learning. If he's gonna get upset, he will go find the cat. He will use the cat as a foil. When he's being abusive to us, there's only one person in his family he loves, and it's the cat. He names the cat. It's Jimmy the cat, right? As if it's a person, but it's it's been a useful thing. It
Amazing.
would be worse. Life would be worse without that cat. And now we're worrying the cat's sick and kidney disease, and he knows about that. And what if that cat dies? Oh my God,
Oh,
there's gonna be hell.
yeah, yeah,
But it's not our journey. We'll figure that out when it comes to it.
yes, yeah. And it's funny because so a lot of the parents that are experiencing child violence and aggression, they say, there's my child, and then there's my traumatized child. And my traumatized child, when they're in a traumatized state, it's not even my child anymore. It's someone else. It's like something else going on.
I get it.
And is that sort of connect with you in some way? Is that something you've experienced as well? It's almost like they said, and I can't even like I wouldn't even recognize them. If they didn't have the same features, I wouldn't even recognize that as my child. And then all of a sudden, when the trauma's over, whether I de-escalated it or it just went out by itself,
You're back.
they're back. It's almost like that. It's like it's not even
Completely understand. And
fully.
so here's I think I get it. I know that's problematic to say my child is what it wasn't that's not my child, this is my child. They're all my child. I get it, but I understand that completely. I wonder what it's like. So right now, well, for our whole life with our 13-year-olds, well, for both of them, our experience of when you say my real my real child, and then that imposter, whoever that evil child is,
Yeah.
we spend way more time with our real child.
Okay.
What if sometime it starts where it's 50-50? In our case, it's not even 50-50. It's not like
Mhm.
it's maybe 80-20 at
Good.
best, at worst, right? That's great. What if and I know there's parents it's 50-50 or 40-60. Then what do you do? That must feel, and now I'm being empathetic, and I think it
Mhm.
must feel intolerable to the parents. Like, and which is why I don't know. I don't know. I don't know what you do, because how much can you take?
Yeah. Yeah. And
And I don't know the answer, but I don't believe there's a discussion
yep.
about that.
Yeah.
And I don't believe there's a supportive discussion about that. So what do we do so that if there's a situation where it's 40-60, how do we support those parents
Exactly.
to continue on the journey that I'm talking about with that child? Because when the parents, and I know there's moments it flashes through those parents' eyes, our journey is there's a fork in the road coming, right? We're
Mm.
going one way and our child is gonna have to go another. And I know it happens, and it's not just an adoption. It's that's a real difficult fork in the road for it, for children.
Yeah.
Really difficult.
Yeah.
And I've seen it, and so when we know how damaging that is for children, I believe it's actually damaging for parents. But we haven't asked those parents really
Mm.
about. So you've done that. what did that feel like, right? When we hear, even in adoption, when we hear about adoption breakdowns, I think the people in adoption world, people in the world in general say, how could you?
Yeah.
How could you? And it is absolutely, absolutely, with unquestionably true, it is completely traumatizing to those children who were adopted.
Oh, yes.
Completely, completely. And that, how could you? Valid question, because they're thinking of it, thank God, finally from the child's point of view. How could you? But who asked that parent? What are you going through now that you've made that? It's not as if they don't know.
Yeah.
It's a how could you question.
Yeah.
And they couldn't take it. They couldn't. So how are they feeling? I don't believe I've seen any studies that talks about, so how do those former adoptive parents
Mhm.
do? How are they thinking? How are they dealing with that? What are they dealing with? Um, and I think, one reason that I think it's really important to do that, especially in adoption, but I think anytime, is because journeys like roads, forks in the roads go off. That doesn't mean they can't come back together one day. But if you just allow that fork to happen, oh, I guess the option's broken, or parent couldn't deal with that child who has severe autism, so they're now in a group homes, right? And then they visit, but somehow the visits stop coming. Where do they go? And if there are people walking alongside both the child and the parent on their path, maybe those paths can come together again. Why not?
Why not?
But it needs support on both sides. We don't. We don't. It's done. We're always zero sum gaming it.
Yes.
Like, no, you give your child back, then whatever, as if that's a thing. Give your child back, so wash your hands, move along. Nothing to see here. That's weird.
Terrible. It's terrible. And then,
It's just weird. It's weird we think about it that way.
yeah, yeah. And it is like you said, a zero sum game. And what parents are experiencing, at least what they're telling me, is, we have two choices. We don't have a third choice. We have either give our child back up to the system or continue living with child violence and aggression in silence, without tools, without support, without even understanding from our own family, having to hide our child, like you said, away from our family because the only positive relationship they have is with the extended family. So we have to make sure that we keep it hidden, so that even further stigmatizes, further isolates them, further puts them in a position where they're completely alone. And they get to a point where, and this is what they've been saying on the show, is that they get to a point where they get to a fork in the road. What are we going to do? How are we going to deal with this? There's no third choice. There's no option where they can safely continue with their child, with the tools, with the set, so that they can continue to forge that relationship and continue to come back, hopefully come back together. But provide safety today and continue to have the connection grow tomorrow. And that third option right now for a lot of parents, they have to find it themselves or just deal with the fork in the road. And it's either which way, it's a loss, right? That fork in
Of
the road,
course.
you're losing both ways, because either
Yeah.
you're going to suffer in silence and all the siblings and the rest of the family are going to suffer along with you, or you leave the child, you abandon your own child, or at least that's the impression, and now all of a sudden, you have to deal with the loss of your child as
Of
well.
course.
How do you deal with the ramifications of it? It's
Yeah.
a loss. It's a lose both
Yeah.
ways. Yeah.
That's true.
Yeah. So
So I think that's really tough.
yeah.
And it does. I mean, it does speak to how we understand children and families in in liberal democracies, and families really. I mean, I know there's been a study done because I was involved in it. It's kind of old now, but about whether the idea was, do we really believe that it takes a village? You know how we say that? People
Yeah.
say that all the time. It's so trite now. Takes a village. Well, when you survey privately on people who live in Ontario,
Mhm.
do they actually believe that? No,
Mm.
they don't. Much strong. They believe they will say it. Most people know that saying and would say they believe it. But when you cut underneath, down the root of it is we believe children. I don't think they'll say this, but children are property and the property of their parents and their parents' responsibility. And if their parents can't take care of their children properly, they shouldn't have them.
Yeah.
That's what we believe. And
Wow.
that see that fits. That if you survey underneath, that's what Ontario believes. It does
Wow.
not believe. There may be pockets and cultures that believe. I believe there's cultures that believe it, and act as if it takes a village where the entire family, extended family,
Mhm.
is feels responsible for a child. So it's those cultures where um, the family needs a break, and it doesn't matter what the child's doing, but the child just is equally comfortable going living in the aunt's house or the uncle's house.
Mm.
And it's not like, oh, I got shunned. It's just that's the way. Or First Nations communities that have an adoption ceremony for the child, the birth child, because the community adopts the child. And
Yes.
actually, the whole community is the adoptive parent of the child.
It's
So
wonderful.
if a family's in trouble, this community takes care of them because it's not the parent's child, it's the community's child.
Yes.
There's other ways of seeing the world, but that's not how we see it. We see it, no, rugged individual comes from capitalism in the United States, and we have that influence even with a little colonial British thrown into it. But no, they're our property, and you're responsible.
Yeah. I wonder
There
how
you
much
go.
of what your theory that you brought up, which I really like, the the sort of the simplistic approach of they're our property, you can't take care of your property, we'll take it from you because you obviously are not responsible enough to deal with it, or you don't have the tools or whatever to deal with it. And I wonder how much of that is where is linked to the stigma that a lot of the parents get when they're dealing with child violence and aggression. They tend to want to go reach out to the community, to the village, to ask for help. They're asking for help. They're asking to the therapist. They're asking for social workers.
No, 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 no. That see, I agree with you, but that's not the village.
Uh,
Those are the state-sponsored helpers to help you be a better parent, right? And so before we punish you as a bad parent by taking your child away, or we accept you giving your child to us, you
uh,
have to go through all the state-sponsored stuff to become a better parent. If we felt comfortable going to the village, we would be we would have a village. That's one reason why we don't go to those because there is no village. We
yeah,
don't have communities. We would be going to our neighbors. We would be talking to our neighbors about the problem and asking them to help us. We
yeah,
don't go to the village because we know they'll judge us and we know they want nothing to do with our children. No, they're not going to, right? We wouldn't dare ask because it's not their job. We don't even believe it's their job to
mm,
support us. And as you pointed out, we can barely count on our own village if we have extended family. We can't count on them.
yeah. I
No,
see.
so we'll go to the state-sponsored, state-funded crutches for parents who don't really and who we know our neighbors think don't really need the crutch. It's just a waste of money.
Mm,
Like suck it up, get it together, or tell your child to suck it up and get it together. That's what we believe.
wow.
I believe that's what, in general, the province. It's not about bad people. It's we're conditioned to believe it. It's help. That's my other big theory, but it's helpful to capitalism to believe it that way.
Yeah. It's also leads to that zero sum game where you have to, you're if you're bad, just that's it. Go ahead. Like either the child's bad or the parent's bad, split them off and move on from there. There's no reparation. There's no potential connecting that child back to the parent. There's none of that. It's just a zero sum game, and then move on from there. That was a point you made earlier, and I think that really connected with me as well. That it just seems like that. That's the way that's what they're facing.
Yeah, yeah. Yeah, I complain about capitalism, but I have to tell you that anything that certainly any school or program, counselor that's been helpful to us, except maybe our pediatricians, but you can count them as small business in a sort of way because they're funded by the province, but they own their own businesses, right?
Yep.
Has been private sector. Not one public service
Oh,
has
wow.
been useful. And
Oh, wow.
so
It's a big statement.
it's the truth. And I would say that one of the reasons we are where we're at, and we're, I think we're doing okay. We're struggling, but a little bit, but we're challenged. But we're doing okay is
Yep.
because we have money. We have the resources. We're not rich, but we have the resources. There's
Right.
two of us, and we have the resources to pay for private service.
Yeah.
You don't have to wait on wait lists. If there's something we need, we're going to go find it and pay it.
Wow.
Education, we've had paid two educational assessments for both children, which are thousands of dollars. We not could not wait 4 years with the public system, 4 or 5 years if ever, and then get a substandard service. And any service we went to in the public realm was ridiculous. And I'm sorry, SNAP is evidence-based practice, but my boy went to it twice and it made no difference. And that was a public service. I'm not saying it's awful, but it didn't do anything, didn't make any difference. But there's millions of dollars being poured into it. I have nothing, I'm just using it as an example. I have nothing against SNAP. And uh, I don't. The behavioral therapists that were helpful to us more than our child, but helpful to us as parents, to somebody to talk to, were all private. Even the center we used, private center. One because
The
we
school's private too.
schools private, absolutely. My because when my youngest got well, both of them needed it, but when my youngest got to grade one,
Mhm.
he was acting out, but he didn't sit still. And so he wouldn't learn and he couldn't learn because he has a learning disability too that doesn't use concepts very well. So he would walk. I'm sure you may have heard of this. He would walk out of the classroom. This is in grade one. Just walk out. Not
Yes.
go to school. Just he liked the vice principal because relationship based guy. This guy like the vice principal. So he'd go walk out of the class. Teacher couldn't control him. Walk down to the office. Sit in the office, and the vice principal, bless her soul, nice. Well, what'd she do? She'd give him her iPad so he could look at the iPad. So
Yeah.
that's what they do, and he really liked her. So one day, uh, we got called that he was being suspended in grade one. Grade one, and I'm thinking, suspended? How does a grade one get suspended? My wife was in there, so my wife was phoning me and go, well, I said, well, I know you can appeal it, so tell her you're going to appeal. And she said, I did, but the principal said, well, I'll send the whole form home with him, and you can appeal. And my wife said, but then it's too late. He'll be suspended. And the principal said, well, these suspensions take time, so these appeals take time. But
Wow.
it come off his record, and we were thinking, no. So then my son would be crying on Sunday nights he didn't want to go to school. And he's like, I don't know what group, I can't remember what age, but say five,
And this was a public school?
public school. So I was saying to the principal, like, I don't care. I don't give a shit what you do in terms of teaching, because you're not going to teach him anything. I get it. But there's 3 months left in the school year. You will find a way to make him want to go to school. That's all I ask of you. Because if he already in grade one is deciding he hates school, this is not a good predictor of how he's going to be in grade 12.
Yeah.
You do it now. I want him to like school. I don't want him to hate you. I don't want to hate him to feel bad about himself. I don't. He better like school. And I had to give her some suggestions about what to do, make him a leader. He likes kindergarten, so let him go back and give him a role, change the chalkboard in kindergarten. I don't care. Make him feel good about himself at school. Make that place safe for him. Um, and so he got suspended, and that was a turning point where he's going, okay, that's it.
Done.
Can't. We had to figure out how financially to manage it. Began looking for smaller classes that knew how to deal with support my son
Yeah.
and my sons, and they went, and it became a huge change. But who can? Why? I mean, we were lucky. We had a house. We could be mortgaged, do whatever we needed.
Mhm.
Not everybody has that.
No.
Not many people have that.
Yeah.
Um, so we did. Yeah.
It's
Yeah.
huge. And it's a big thing you talk about is that relationship with school, that relationship with society needs to be positive. And wow, and the factor that, you know, you had the financial means, and not every family has the financial means to deal with the private system and have to deal with the public system. And that the public system, very bold statement, but very means it means a lot more for me because I know that you're very much connected to the public system.
I am.
And so that was big for me. That's huge. That's
That's it.
the to come out with that means that there really is something broken in the public.
I'm telling the truth. I'm talking about quality of and service and quality of care. I am telling a truth, right? I'm not talking about private group homes or private seniors care. I'm talking about if you want quality of service around, say, mental health issues, find a private practitioner. That's been my experience. Don't go to city direct operated run. And I've worked in. It's not just I was the advocate. I worked in those systems,
Of course.
right? There's no quality. When I worked in those systems, I've had parents whose children had autism, and they felt like they needed to find a group home for them.
Mhm.
And I know there are no standards of care in those homes. I know there are no standards of care for publicly funded mental health services. None. So
Wow.
there's none. Like there's you shouldn't abuse the kids. There's the room has to be this big,
Mm.
but is there a measure, understanding of the quality of relationships that the children will have with the therapists or the teachers or the
Mm.
practitioners? No. And are you a customer who um, has a right to ask about the standards and know whether the standards meet and complain if you feel the standards aren't being met?
Mm.
No,
Wow.
no. If you do in the public system, and I know the people you talk to will understand this. You quickly become the crazy parent.
Yeah.
It becomes confirming information to we knew that this is those parents' fault.
Wow.
That's what happens. Ask people.
Wow, wow,
Go
wow.
to if you have a IPRC, those meetings in the school where they bring kids with special needs and they have to develop a individualized learning plan or what they call IPRC, and they have the social worker there with the teacher and the principal, the occupational therapist. I'm thinking about the ones we had in public system for my sons.
Mhm.
They're all there. And what does in front of in front of all these people, what does the social worker ask? Social worker for my son, both
Wow.
sons. How's things going at home? How's the relationship between you and your wife? Oh my God, my wife went berserk. It's like, what the?
No.
Yeah,
No.
yes,
Went there.
yes. And they go there. This
What?
one just happened. They think that. They think about that as if because there's this thing about confirming information, right? For social workers, especially social workers, but lots of sup- helpers. You get in your mind's eye what the problem is. You
Uh-huh.
want to be good, and you make a theory, and any information you get confirms your theory. It's it's
Unbelievable.
it's
I
why
mean,
racism exists too. It's why it's so hard to break racism because people have an idea about what a black person's like, and then everything they see confirms that information. That's why police shoot black men in this anywhere more often.
yeah,
They know it's going to be dangerous when they stop a black man on a driving call.
yeah.
I'm not saying it is. That's their thing. And when the black man doesn't put his hands on the wheel, uh-oh, confirming information that there's a problem, confirming information there's a gun in the car. Everything, that's how we think.
Right.
And you have to unlearn all that.
So when you went to these public,
These IPRC meetings, yeah.
sessions, IPC meetings, it was almost like you
Yeah.
were being put into this. The theory was already formed about you guys, like, according to your
People
perception.
hold their own values and their
Confirming
own ways of
information.
thinking when you go. They
Yeah.
haven't even met us. They already,
Wow. And they were
oh
looking for
yeah,
confirming information
yes.
to
And
verify their theories.
there's other things that go on there too, right? In the public school system, any parent will know the meetings are at a certain time when the teacher can be there. So 8:30 to 9 or 8:45, 8:15 to 9
Mhm.
and 3:30 to 4 maybe. And maybe the school has 40% of the students have some kind of need for a IPRC.
Yeah.
And so now they have to fit all these parents coming in off their work. It doesn't matter. You go and you meet that time, and then they got 15 minutes.
Wow.
15 minutes tops.
Wow. 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 Wow.
And the teacher, by the way, even a good teacher, right? But if the teacher doesn't like, they're sitting on a classroom of 10, 20 kids, 10 of whom at minimum have some special needs and special ways of they need to be taught. And the
Mhm.
teacher is thinking, I have I can't do all this. And then they send a person from the board in, a consultant, who's supposed to look how are the needs being met for the students. So teacher feels like they're being
Wow.
spied upon, and they're coming to the meeting with all this baggage.
Wow. Wow.
You got
Wow.
the social worker with her baggage because she's got 15. It's a complete
Disaster.
cluster mess. And as if that solves anything.
Wow.
And when they say, and we need a this or a that for that classroom, and the principal says, well, I have one uh, education assistant, and I have 150 students who need that educational assistant. So you can say what you want in your IPRC. Well, I can't deliver it. I got one. So what?
Wow.
And Education Act gets the right. Yeah, I get the rights issue, but okay, sue me, right? What are you gonna do? I don't have any more. I can't do it.
Wow.
Um,
Wow. Wow. Wow.
every parent with a kid with special needs will know this in the system, and if you have no means, you've got to cope. Like, what do you do? What
Mhm.
do you do? And you remember how you said you have to hope.
Yeah.
Now, how hard is it for parents to hope then? They're living with what they're living at home, but
Yes.
then you got the example of school system, but it could be any system. You got the example of school system like that, and you're expected to hope that
Yeah.
some that just adds to the oh my god, what's gonna happen?
It adds to the despair. Absolutely.
Yeah,
It's huge.
yeah, it's awful.
It's awful. And I can't thank you so much for bringing this up because again, you're bringing up, a lot of components that haven't been approached yet. Definitely the public system versus the private system, is completely different. And also the kind of baggage you have to deal with when you get into the public system is really not there, and the service of care isn't there. These are very important, elements of, and challenges that parents have to deal with when they're dealing with CVA, right? With child violence and aggression, because they don't have the support in the public system. They don't have the village, as you mentioned, being out there for them. So what do? Uh,
I
y-
just want to say this because so that and I hope nobody would perceive I'm saying this. I actually support public schools. I
Mhm.
do not like. I do
Yeah,
not.
and I
I
know
do
that.
not. I do not like the private system. I do not like private for-profit care of any kind. I don't. That, but so, and I not. There is no reason why the public system has to be the way it is.
Yeah.
And when I have a choice, and it was a political choice for me, right? When I have a choice, is my kid going to go to private school? I'm doing what I need to do and what I can do for my kid to make sure they have a future, right? To be on that path.
Yeah.
No, I'm not going to say I'm not doing it because I have a political bias against the private system. No, I know as being working in it for so long, I know exactly how the private system works. Somebody introduced me to this concept of rituals now, and I didn't know there's a whole body of knowledge about rituals of bureaucracy, how bureaucracy works in a ritualistic way. There's a ritualistic way of private for profits working too,
Mm,
and that those rituals that are part of the systems, not any one individually, need to be crushed.
yeah.
The idea of helping from top down, of we know better, of expertise, of service being the outcome, not the outcome being the outcome of not there is interesting of lots of services, not individuals in it, but in the service system, in the teaching, people will often say, oh my God, when they can do something that they feel was meaningful for their job, they can often say, oh my God, that's what I went to school for. I want to just be able to do what I went to school for. They
Yes.
can. And usually that's about caring. It starts with an ethic of caring,
Yeah.
not an ethic of service delivery, an ethic of 6 brief therapy sessions and they're out. Not a,
Yeah.
and that's not ritualized in our public systems. Anything but that. Everything else is tick boxes, numbers, curriculum. Get through that curriculum as if it makes that much a difference. Uh, that in the schools, um, I would say, uh, give them a pill. And I remember I'm for medication, but not as the only solution. But give them a pill, move them along.
Yeah.
That's what's ritualized,
Yeah.
not caring. Yeah.
And that's the one thing they need is caring. The most
Of
important thing.
course, carrying and both the parents and the kid.
Yeah. For both.
That's that's what humans need.
Yeah.
The most important thing: belonging, caring. And what does caring mean to people? It means different things, but in general, it means being understood, being listened to, and heard.
Yeah.
Kids need that. Parents need that.
Yeah.
They need a that develops a sense of belonging anywhere.
Yeah.
That when you develop that, you're halfway home. Like I believe with some of the most challenging situations with children with mental health issues, I remember the parents feeling, saying, you know, afterwards when if they've come through, just I know they might say not necessarily to me, but to about somebody else. I know they didn't do that much, but just having them there to hear me,
Yeah.
that went a long way.
That's huge. That's huge.
It's like it gave me a fuel. It gave me belief. It gave me hope. It gave me a whole bunch of things to carry on my journey.
Yes.
Uh,
Yeah.
how do you how do you explain that to uh, quantify that in dollars? Explain that to funders. Explain that to measuring outcome. This is really tough. But I remember young people telling me, but it's evidence. You know why it's evidence? Because if you think about it in your own life, Erwin, and what made a difference to you,
Mm.
it's going to be people. You're going to think of who was there anybody that made a difference, that inspired me, supported me, cared for me? My friends, your parents, your a teacher. If you went to counselor, it's going to be people.
Yeah.
So they said it's true. You ask anybody, they'll say the same thing. Isn't that evidence? That Irwin, they said, you are the living evidence. You are evidence. That is true.
Yeah.
But I thought that was really brilliant. One of those mic drops that they do. It's a really brilliant thing to say. You
It is.
are the
You are the evidence. Exactly. And we are the evidence.
if you're in a government job or a politician, you have been what we would deem successful. Just think about it. How did you get there? Really? Like, what made a difference for you to get there beyond the people who wanted to but couldn't? There's people made a difference to you.
Yeah. People believe.
Okay. You know that. So get it done.
Yeah.
And then they add, and it's not rocket science. I remember they'd say, oh, I said my name. They'd say, it's not rocket science. The young people would say, like, you surprised at this? This is not rocket science.
Yeah.
What's wrong with you? What's wrong with you? How come you didn't figure that out before? It's like, come on.
Because it's the one thing that's kind of hard to give. It's kind of hard to give compassion and understanding when, especially with child violence and aggression, it's so out there for a lot of parents. I know for myself, I personally came in with a lot of stigma, a lot of thoughts about it, and I kept, I kept thinking discipline was the key, and a lot of those stereotypes and those things that you mentioned, I came into this podcast thinking like that. I've completely changed. I realize now I had no idea what was going on. I didn't understand what the situation was, and I only now beginning to respect all these parents so much more. And I call them super moms and super dads that are dealing with this stuff day in, day out. Like you said, some of them are, you're very fortunate if it's 20/80, but hey, some of them are 60/40 the other way, you
Yeah.
know.
Yeah.
And even then, even 20/80, I don't know what I would do, right? It's not something that it's totally alien to my world and my perception, but now is part of my reality. It's part of that shared reality that I have, and I can't walk away from it anymore. I can't just say, "Oh, it doesn't exist," or "It's not real," or "It's just a discipline issue," or whatever it may be. No, it's not. It's absolutely not. It's completely something. It's a different creature completely. And these parents are incredible, having
It's
visited.
true. It's true. I agree. I just want to add, it's also true for the children.
Yeah.
So if it's 20/80 and you accept that children don't want to be like that,
No.
and I'm guessing maybe not in the midst of it, but in most days, parents will accept, my child doesn't want to be this way. That's not, they would say, that's not them, right? Okay. So that child lives in that state 80% of the time. Can you imagine
Yeah.
how horrible it must be for a child to live in that state?
Yeah.
I'm not saying I agree with you about the parents,
Yeah.
but it's not either or, right? So it's like
Ah,
everybody in that situation is hurting.
yeah, and thank you so much for adding that, because and that's the other element as well. The parents, they don't speak of their child as a bad child. Not a single parent I have talked to so far has said, "This is my bad child," or "This is my, my issue-based child." They've actually said, "This is my incredible child. This is my wonderful child. This is the child that's living through this with me." And I can't believe how hard it must be on them to have to go through this. What these parents are asking for is they're asking for understanding. They're asking for compassion. They're asking for help. They're asking for tools, to be able to deal with this. They're not blaming the child, and they're not blaming themselves, thankfully. If anything, they do blame themselves more than anything.
Yes,
But
yes,
it's really these incredible families that are trying really hard, both the child and the parent, to kind of work together, with very little support or understanding from the village, and definitely very little support from the public system, right? And how to deal with this. And they're just on their own, trying to work it out as a family together. But yeah, absolutely, and thank you for bringing that up. It is the child that is incredible too, dealing with this and trying to work through this and trying to always go back to a place of love once the trauma's over, right? And go back to a place of trying to work things out. It's just the support isn't there. That's it. And the compassion and the understanding just isn't there. That's just what I'm seeing so far.
Okay, I'm talked out now. I'm tired.
Well, thank you
What
so
time
much.
is it?
Really appreciate.
Woo!
This is
Late.
awesome. This is
Well,
awesome.
thank you.
I expected it to be awesome, but hey, you know, totally, totally wonderful experience.
Okay.
Well,
Thank you for
so much.
talking to me, listening.
Yes, thank you so much, and I look forward to hearing your thoughts on how it worked out, and as you hear the podcast, and what you think about it, because your opinion is all opinions matter, but being in the system, being part of the system is really important. I mean, it's pivotal in the kind of important issues, important aspects of the issue that you brought out that
I'm
are
hoping that because I'm involved with this with Julie, right? Like
Mhm.
in this consortium, she's calling it,
Yes.
and I got Public Health Canada to come on board. I don't know if she told you that.
Yes, I heard about
And
this.
then when I was talking to them, they did exactly what she said. There's these two women, the director of Public Health Canada and her manager, and I was explaining. And then one of the reasons they said we're in is because one, they never heard of this issue. They heard of the issue, but they never heard that there's no literature, nobody talks about it, they get it. And then at the end, they both said, well, she said, the director said, my best friend, her family, her child has mental health issues, and she's been attacked by her child.
Yeah.
And then the manager said, I never told you this, but my sister, and they're not adoptive parents.
No,
They're
no, biological. Yeah.
and so I'm going, Julie, this just happened. And it's exactly what you said. When you go and talk to people, everybody knows some 6 degrees of separation knows this is something to talk about.
Yes.
And there's this pushback she's getting, I think, from the child, which I'm one of them, the child rights activist kind of people saying, oh, you're going to end up blaming the child and stuff. And I hope, because I'm involved in this with
Yes.
her, I can help bridge the two, saying, no, like, no, you can't argue that I'm not on the side of public system or children's rights. No, this is bullshit, right?
Right.
It's both of them. Do you not realize that it's both? Like, you have to think about both are suffering, the child and the parent. And
Absolutely.
when I say that, because I did have some experience with Julie, some of her adoptive parents who wanted to correct me and felt I wasn't hearing, and I get that's going to be the pain that they're suffering. Well, you're not hearing, but it's not. We're the victims, and I'm going. I get it, but there's two. Like
Yeah.
it's both.
Yeah. And
It's
it's so
one
good.
or the other.
I really love it that you're there, because you really are that glue, right?
I
Between
hope I can do that, but
Absolutely. I think it's going to add some validity and some authenticity to that problem. But the key element is, like you said, it's raising it up. Until if you didn't raise it up, those two other individuals couldn't talk about it. They couldn't.
yeah. And
They
that's part of the thing I think has to happen is you can't get to it's two until the people, the parents who feel so silenced, their feelings are invalidated. First, I think they obviously get there, but we need to feel like, okay, it's not you. You're okay. Yes, there's problems and you need to be supported, and we've heard you. Then they will, as you said, they don't think their children are bad, so they will move to say, okay, well, we need to help our children because they're suffering too.
Yeah. Yeah, and it makes sense. I mean, the parents that are going, at least on this show, that have done this, they've stuck with their child. They've wanted to go with their child, and it doesn't mean that if they let go of their child, that somehow they're bad parents, right? They've had a fork in the road, and that's what they've had to do, one or the other, right? They had to look at the safety, but at the end of the day, these parents are so um, they're living through things that for me were unimaginable. I can't say they're unmanageable anymore because now I'm experiencing them, or at least living through that with them. But it's really out of my world, and I can't really even define it. I don't even know how to conceptualize it. And I'm hoping that by this podcast and by all the hard work that all these organizations are doing to raise the visibility, people can go, you know what, this is something that's really out of my scope, but has always been there, but I didn't quite understand it. It's just been hanging around, like the elephant in the room that I didn't quite know how to pinpoint, but it's, oh, this is it. Yeah, this is it, you know, but I didn't know what to do with it. I didn't know. I just heard about it. I heard about my sister going through this, or, my brother going through
That's
that.
exactly what the
You know what I
people
mean?
at public health said. And because she said, I didn't know what to say to them.
Yeah. You don't
I
know.
don't know. I think I don't know.
Exactly.
Yes.
So awesome. Well, thank you
All
for
right. Thank you.
The silence is a deadly killer. The silence fosters alienation, pain, and hurt. The silence is deafening. It's flooding my ears, my thoughts, my heart with the voices of those families that suffer in silence. The silence is bombarding me now. I cannot be silent anymore, not after experiencing this with the families. I cannot be patient anymore, hoping the problem goes away. I cannot be complacent anymore, knowing that their plight is society's plight. Their pain is our collective pain. Their story is our story. I cannot accept the silence anymore. Parents and families need to be recognized for what they are living through with child violence and aggression. We need to put in place adequate support to elevate the parent-child relationship. We need to elevate the matter to justice and public health. This issue is a silent monster. If we deal with it, we may very well be uplifting our future with less violence in society, in addition to taking care of our present families. I would love to say that these families' experiences are singular, that it is uncommon. But research has shown that to be completely otherwise. And that is why You Matter podcasts on CVA or child violence and aggression is here. And that's why you're going to hear stories that differ, yet are just as horrific. Let's bring this deadly silence to an end. Let's come together, families, communities, support workers, justice, public health, and mental health, to provide these incredible families with the support and validation they need to weather their children's storm, so we can help bring their children back into the light and love of their arms. Thank you for being here, for opening your ears, your thoughts, and your hearts for them. For they are your neighbors, your brothers and sisters, your friends, your clients. Above all, they represent the most courageous of us, to live what they live and still work towards a place of love. Thank you for showing them why they matter.
I'll never be